services by multiple transportation modes, no matter their financial means or their physical abilities. We do our work. We're best known for our advocacy role, but we also do a lot of direct technical assistance. And we also do research and analysis into how the existing system is, or often, as it turns out, is not working. I have been director for about 18 months. I grew up in New Orleans, Louisiana, went to school in Baton Rouge, go Tigers, and came up to DC, worked a little bit on Capitol Hill, and went on ended up working for Senator Tom Carper of Delaware. At the time, he was the only member of Congress that was on all three of the transportation committees, because as any multimodal approach would have you do, you split everything up into three different committees. Welcome to the US Senate. Went from there to use the Delaware connections to make my way over to US DOT at the beginning of the Obama Biden administration. It's amazing how many things come back to Delaware. And then after 5 years at US DOT, where I was the Deputy Assistant Secretary and Assistant Secretary for Transportation Policy, I came over to Transportation for America. The thing I was best known for at the US Department of Transportation was running a program that used to be referred to as Tiger. As an LSU grad, I liked that. But then they went and changed it to Build, which is probably a more appropriate name, but as a Tiger, I don't appreciate it. And while I was there, I also worked on the Secretary's Livability Initiative. So here I am at Transportation for America, and getting geared up for potential stimulus packages and reauthorization.
Great. So how has COVID-19 affected your work through Transportation for America?
You know, there's the day-to-day in that I'm sitting in my basement with my 12-year-old and 9-year-old running around unsupervised upstairs. Good thing that they are relatively independent, and trying to figure out what everybody's trying to figure out. We are focused on surprising legislative targets in terms of COVID recovery bills and a potential stimulus package. We are now focusing on getting operating support to transit to keep it running, to make sure essential workers can get to their jobs, so that, you know, those of us who might be able to drive ourselves into the hospital actually have someone there to take care of us. Car doesn't do us much good if the people we need aren't there. And keep transit operating in an efficient and functional way. But frankly, our priorities remain the same. The needs for change in the transportation system are actually more apparent now than before COVID-19. The things that we have been saying about the lack of safety on our roadways has really been proven as the traffic has gone away. We've got story after story about people driving 100 miles per hour and higher. And actually fatalities as a percentage of travel are way up, because our roadways are designed for speed over safety, and our priority is safety over speed. You know, the people who need transit, we love to call them transit dependent, as if we weren't dependent on those people being in their jobs. COVID has made clear that we're all transit dependent. Again, no good to get to the grocery if your groceries haven't been unloaded. No good to get to the doctor if there's no nurse there, or hospital if there's no nurse there to take care of you. And so our work really, and our priorities, you know, have been bolstered by the moment, because emergencies have a way of showing what's not working better than anything else.
Right. I said some of us have understood how important transit is, but it took a global pandemic to really highlight and illustrate how essential it is to a thriving city, region, civilization, what have you.
Absolutely.
So let's dig in a little deeper. You mentioned that you're doing some work and trying to get operating support for transit. I know that you've been really busy on this, and we had the first, the CARES Act came through, but can you give us a little more background on what you did for the CARES Act and what's going on now?
Absolutely. It was a really interesting experience, and I kind of feel like it would be a great story to write, because it actually comes down to me on the bus reading the Washington Post on my phone, which is something I would do most mornings. And there was an article that said that the Trump administration was considering sending all of of the federal workers home to prevent the spread of COVID. And in reading that, I thought, sitting there, on a WMATA bus, every time the government shut down, it's been devastating to our transit system because we're a government town. That's a lot of people not going to work. And then it occurred to me, this is actually way worse because they're talking about the whole city shutting down. They're talking about there won't be essential workers except for people who work in security, like my husband. You can't work from home because you have to work in a secure facility. Otherwise, everybody that used to be considered essential, they aren't going to work, and neither is anybody else. So what is going to happen to transit?
Mhm.
What's going to happen is they're going to start slashing service, which is going to make it really, really hard for those we need to get to work to get there. And it's also going to result in crowded buses because as you slash it to have, the maximum number of people on the bus, you're doing the exact opposite of what is important for COVID. And this all just comes flashing through my brain. And so I just started calling around and asking people, well, what are you hearing? What are you thinking? I talked to some colleagues of mine on Capitol Hill, and they said, oh yeah, we're going to get to transit and a stimulus bill. That's going to come later. And I said, but I'm not talking about stimulus. I'm talking about emergency relief. What are we going to do for transit and emergency relief? And they're like, no, we're going to come up with a stimulus package to build stuff. And I said, why would we spend money building transit when we're not operating what we have? Like if people are shutting down because they can't operate, that's a devastating, short-term issue. And I just realized that that's not the way we think about transit at the federal level. So we geared up. We just threw together a letter. In 48 hours, we had 250 signatures and, supporting operational assistance for transit. We went and reached out to some of our friends who reached out directly to members of Congress. We had great support on both sides of the Hill from both parties. Roger Wicker of Mississippi was a huge help on the Senate side. On the House side, the leadership got it right off the bat. And they bid each other up. We got $20 billion out of the Senate, $25 billion out of the House. They agreed to $25 billion. This all happened in 2.5 weeks. It was the best 2.5 weeks of my entire career, which is more than 20 years old. So that will never happen again, to have that kind of success that quickly. We've now been following up to figure out what we need to do over the long haul.
Yeah. Does that have anything to do with the HEROES Act coming out of the House, or can we expect that or something similar to pass?
I don't think you're going to see anything like the HEROES Act pass. I think you will see something pass. And what that is very much in Mitch McConnell's hands right now. He originally came out and said, we don't need another recovery bill. And then there's been a pushback on that. And he has now said, I'm in favor of a recovery bill, but it has to be really directly related to COVID. I don't want this to turn into a Christmas tree where we just go spending on what we wish for rather than what we really need. Oh my God. I need to make sure that my phone is off. It's the only way it doesn't do that. So we're waiting to hear from the Senate what they think is appropriate and doable. I do think you will see something for essential workers, which was in the HEROES Act, some sort of hazard pay, some sort of relief. And the House included transit workers in essential workers. That was another lift, but really got positive feedback once people started thinking about it, that no good to designate someone as essential if they can't get to their essential job, and therefore the transit workers are essential too. And more operating assistance. We're asking for over $30 billion in operating assistance to keep them rolling through the next year too. But just getting us through December, I think a good deal of what the House did is fine. The House was specifically looking at the criticism that their original $15 billion fell unevenly in terms of needs on different transit agencies, where the largest transit agencies got 3 to 4 months of buffer, and smaller agencies got 12 to 15 months. So they were trying to even that out. I don't know if the way they did it is the best way. We're really looking at it and talking with transit agencies, but I do expect there will be more aid. I just don't know exactly when it will come.
Okay. So far this has been effective, the FTA CARES Act. and it's enough for now, as what I'm hearing, basically.
Yeah, for the big agencies, it's not enough for very long. It's going to get us through the summer, and that's it.
Okay. So in terms of that, as we continue to reopen our economy in our cities, Nashville just moved into phase 2 of reopening, which means, you know, basically they're tipping their, toes in the water to say you can come back on transit now, and you can, go back into restaurants at, what is it, half or 3/4 capacity?
2/3.
Two-thirds?
Mhm.
So, as people begin to gather
Couldn't
these
get me
days,
in a restaurant that's 2/3 full. No way.
that just started yesterday, so it's brand new. We just got into phase 2 because we've done so well with flattening the curve and staying home in phase 1. So now we're in phase 2. So as we reopen, in what ways, Beth, do you see public transit rising to the challenge to help us rebuild and resuscitate our economy?
Well, I'm hoping that people now recognize how essential transit is to a functioning healthcare system, supply chain system, economic system. We have a lot of people out of work. They are less able than ever to take on added expenses. So we probably will have a bigger demand for transit from people that don't have a lot of choices. I hear a lot of people wringing their hands over whether or not the wealthy will ride transit. That's not actually my first concern. My first concern is getting as many people back to work as possible. And the people who have been most hurt are the lower income levels. I want them to get back to work because that's when our economy really functions. And transit will be absolutely essential for that. But transit's going to have a heck of a challenge on its hands, not just in terms of the loss of fares, but in terms of everybody who's paid for with sales tax. Sales tax is a mess. There are some agencies that are paid for with income taxes or property taxes. The property taxes are going to be stable for the longest, but the hit's going to come late, much later than most systems. And those that are paid for that way are very concerned that by then people will forget that they need help too, and they will be punished for their early term stability. Income tax will hit late too, but it will be hit more because of the job loss. They're also concerned. So just trying to figure out our way over the long term to make sure that it doesn't take 10 to 20 years for transit to get back on its feet, to recognize what an essential part of the economy it is going to take long-term thinking. I also think, though, there's a lot of theoretical fear, but when people start getting back to normal, people just start getting back to normal, and that happens pretty quickly. So we need to make sure that people feel like they are in general control over their surroundings, as opposed to in the past where transit skeptics took the position of, if a bus hasn't jammed its customers up against each other like sardines, then it's a waste of money. Maybe we can finally revisit that and suggest that maybe treating our customers like a restaurant would, and not, shoving them together cheek to cheek, would be a good thing overall. It'd be good customer service. And in this age, maybe we can recognize that we should give people some space, and that would be good for many, many reasons, not just the health reason going forward. So I think just in general, this gives us a chance to revisit some of our past assumptions, and get creative. But we have to recognize it's going to be truly essential for a lot of people, and that we need to give people a sense of control over their own space. Give them a chance to clean their own seat, give them a chance to have some space between them and the next person. And then I think you'll see things just getting back to normal.
Yeah, I think so too. I mean, we're already a cost burden region, meaning that over 50% of our households are spending 45% or more of their annual income on housing and transportation. Right. And so with the incredible, the exponential rise in unemployment rate, I personally can foresee a real strength in building up our transit and enhancing our services in order to help us resuscitate our economy more quickly and to a more stable ground, better, faster.
Yeah. And, even when the economy was rocking and rolling, there were articles about regions of the country that had job openings in one side of the city and people who were qualified for those jobs in other parts of the city, but those people stayed unemployed and the jobs stayed unfilled because we didn't have a transportation connection. And that was considered a great functioning, efficient economy. That's such a grossly wasteful and sloppy economy. I do hope that this is a chance to revisit that and recognize this economy is not going to come roaring back if we persist in those sorts of disconnects.
Right. So we do have a question from one of the attendees, and he's wondering about the timeline of transit recovery. Because you had mentioned maybe it taking 10 to 20 years before transit recovers, and he thinks that's I know. Well, he thinks it's a shocking reference because transit is essential, and he's wondering where that reference comes from, 10 to 20 years.
Well, after the Recovery Act, it was 10 years before a lot of systems got back to where they were pre 2008. And I hope we take a chance to learn from the past. The United States is really bad at this. We love repeating the same mistake over and over and then wondering, we are so eager to come back from a problem or a mistake, and we want to put aside the bad news very quickly. So there's no chance to learn then. And then when you have to react the next time, you're in a rush. So there's no chance to learn then. So we just go through these cycles. My organization is insisting that people learn from the last experience with the Recovery Act. And look, we've got some good news. With the Recovery Act last time, we provided zero operating assistance to transit. So transit systems just slashed service right and left. And like I said, it took 10 years to dig out from under that. This is going to be a way worse economic slump. So I don't want it to take more than 10 years. The good news is, for the first time in history, the federal government offered direct financial assistance for transit operations across the board. So maybe we are in a different era. Maybe we are going to collaborate and recognize that transit is essential and we can avoid that mistake. But if we act the same way we did 10, 12 years ago, yeah, you're looking at decades-long slumps. That's why we can't repeat the mistakes of the past.
Yeah. It's the quintessential, you keep doing the same thing over and over again, expecting a different result.
Yes.
The definition
Exactly
of insanity, right?
And I fear that, unfortunately, in transportation, we're particularly guilty of it.
So I was rereading your report on lessons we can learn from the 2008 recovery. And let's dig into that. Okay. I'm really interested in it. I love learning from history. I was a history minor in college. So here we go. In your report, Transportation for America describes the proclivity to expand existing programs during the economic recovery as poorly tailored to the task at hand. I want to hear more. I want to hear you explain why those existing programs were ill-fitted and what better way we could spur and grow an equitable economy during this period.
Sure. And I'm going to take the time, like in all of these situations, one of the reasons I find them so frustrating is I can absolutely see everybody's point of view. And I really want to just find someone who's wrong. But in this case, I almost always can see it from everybody's perspective, which makes it harder. So with the Recovery Act, Congress was in a rush. I happen to know this because I was working in the Senate at the time for Tom Carper. And we were putting together the Recovery Act, and he was part of the I don't remember what we called it, like the Gang of 12, or it was one of the gangs, and trying to put together an agreement that could get through the Senate. Mm-hmm. And it was very challenging, and we didn't have time to author whole new programs. Or that's how we felt at the time. We had to get that money on the street. We had to get people back to work. So what we did was we took programs off the shelf and dumped money into it. Here's the rub. With the transportation program, for example, the transportation program was not created for the explicit purpose of creating short-term work. That might be one of the almost, incidental outcomes, but the goal was not to get people to work quickly. The goal was to share equitably amongst all the transportation agencies, federally raised funding so that they could manage and operate and maintain their existing systems. That That's the point of the program. So if you take money, that program, and you put more money in it, it will do more of that, equitably distributing money so you can operate and maintain your existing system and improve it where it needs improvements. That's not short-term job growth. The purpose of the Recovery Act was to put people to work quickly. And then we're shocked that when you just shove more money into a program not designed for that, that it doesn't accidentally do something it wasn't designed to do. So what we are saying in the report is, if your purpose is short-term job growth, then you need to fund projects that generate the most jobs as quickly as possible. And so we went back and we analyzed, we actually did this back in 2011, 2012. We looked at what the states were reporting in terms of job hours per project. And what we found was the projects that created the most job hours per dollar were transit projects. Transit operating's at the top because it's almost all jobs. Transit work is second. That's generally because you're not doing a lot of right-of-way acquisition. You're building transit in an existing right-of-way. The third is roadway state of repair. If you think about it, roadway state of repair, you can turn dirt real quick with a roadway state of repair project, as opposed to a roadway expansion where you always have to acquire property. Right-of-way acquisition costs a lot of money and generally only employs a couple lawyers. And while I'm sure the legal profession is super excited for the added work, that's not generally the job creation we are seeking. So if you want jobs created quickly, that's your hierarchy right there. But our funding prioritized roads over transit, so fewer jobs. And our program does not tell people to focus on state of repair. In fact, our program says the state knows best, and so many states will build new assets that they already know they can't afford to repair while they're not able to afford to repair their existing system. And you can get more details on that in our report called Repair Priorities.
Oh, nice. Well, that was an excellent answer to why they were ill-fitted together, like putting a round peg in a square hole, right? I mean, it just wasn't designed, those programs weren't designed for quick job creation.
Absolutely.
Right. It also, as I was reading it, and you kind of alluded to it in your answer, it just seems that a lot of states missed the opportunity to fund programs that would have had a higher ROI in terms of, in terms of dollars spent and also jobs created. So the two different aspects there.
Well, in their defense, it wasn't asked for. They were asked to move money, not to create jobs. And we just hope that creating jobs and a lot of jobs and the maximum number of jobs would be the happy accident. We could have asked them to do that analysis and pick the jobs that created the most job hours. We just didn't. And so states moved the projects that they had ready to go. I think one of the challenges there is a lot of the projects that might have been ready to go in December 2019 aren't the projects we need in this new world where we're looking at an altered economy into, at least the medium term, if not the long term. We are looking at a down economy. We are looking at an economy where we won't just be going back to exactly the world we were in before until we have a vaccine. We're talking hopefully of 18 to 24 months. But, if you're reading how long it's taken to develop vaccines in the past, 5 years is amongst the best times. So, recognizing that the economy could get rocking just in a different way means what we had developed in preparation for the future when the future looked totally different, probably not the best investment, even if it is the one that's most ready. So that's a very different approach too, and requires a very different kind of thinking. I hate the term shovel ready. It assumes it's a capital project. A capital project may not be what's needed. We might need a paint ready project. We might need something that just reallocates the space on the roadway. We might need something that's more operational based. There's all kinds of things that we could do, but it probably wasn't what we thought we needed at the end of last year. So it just requires a whole different mindset. And if we really want to stoke the economy, we have to think about what we need right now, not what we needed 5-6 months ago.
Oh, yeah. So in terms of prioritizing job creation and recovery, how does that change capital spending in the way it's allocated then?
Well, I don't know that we need to change the allocation by state, but we probably do need to change the allocation in terms of where the money goes. And that starts with a determination of what it is we need. So if it's job creation, let's have the transportation agency do an analysis of the job hours that will be created per project, per dollar. So keep in mind, one of the things that often happens in transportation in general is the numbers of in terms of benefits always look good when the project is super expensive. But that's not actually the best allocation of dollars. I've often heard the deputy secretary for the Virginia DOT say that if I can get as much benefit from 100 $1 million projects as from one $100 million project, they're equally good, even if one's flashier. And the one $100 million project will take longer to get done and only benefit one community. And I think that's a very different attitude than we normally bring to transportation, but it's really what's required here. And we need to think about, you know, how to get the most benefit. So first we have to agree on what are the benefits we need. And I think that there are two. There's job creation, and then there is what is going to create the healthiest community possible in the era of COVID.
Right. In your report, it was you talk about how when the states would choose building new roads over building new transit infrastructure, for instance, and we had this conversation very briefly. But what can we do to help elected leadership opt to fund transit and infrastructure over building a new highway?
Yeah, well, so one of the things is what I just mentioned. Well, I'm going to back up and say, remember, the money we hand out from the federal level goes to state DOTs. State DOTs have a particular perspective. Most of them were called departments of highway until very recently. And even if they changed their name, and they all have, they're still designed the same way they were. They don't have transit departments except for rural transit. And it's normally just a way to distribute funding. So how would an agency that has no transit expertise come up with a transit project? I mean, they're completely designed wrong. And the governors probably need to think about what sort of role they need to play right now to be participants in transit. And one of the ways we can do this is if we make people go through an analysis of job hours per project, it'll become real obvious which projects are going to produce the most jobs. And if a state then wants to say, no, I want to spend this vast amount of money on something that creates far fewer jobs per dollar, they are very welcome to make that case and see how their voters respond to that. But I don't think that will be very popular. I think the other thing is to ask them to do an analysis of, you know, what takes care of our essential workers, and what will allow us to be most economically productive in a time where social distancing is important. We know that health outcomes are better in areas where people can stay active, where people can get access to outdoor air. Their immune systems tend to be stronger. But we need to make sure that they aren't, you know, pushed up against each other. Most states have a policy that they will not build, and if they will build, they won't maintain sidewalks, which leads to the narrowest sidewalks possible being built if they're built at all. Even in places that are highly walkable, the sidewalks are rarely 6 feet wide, and we need to be 6 feet apart. So all those things need to be revisited, and putting things in terms of health, access to work and opportunity, especially for essential workers, and job hours per dollar spent all happen to work out very well for arguing for transit funding.
Yes, and some of that is in that report. I highly recommend that everybody on this call who's attending to check that report out by Transportation for America. You can visit their website, t4america.org, and look at that there. That's where I'm getting a lot of my questions, but I'm going to move into we're getting a lot of questions coming in now from attendees. So I'm going to go and jump over to those. What funding changes on a national level can be implemented to help create more funding for transit / is the federal funding formula no longer effective?
Great question. I almost feel like that was a plant, but I don't remember planting it. Yes, there are certain things that we can definitely do to support getting more funding for transit. One is just tell stories, and we're actually collecting stories. And if you all have access to any, please send them our way. We want stories of people who use transit and why it's been essential for them to have access, not just to their jobs, but to healthcare themselves. This has been an incredibly powerful message. And the reason we had such strong bipartisan support is everybody got the notion that a hospital doesn't function if everyone can't get there. And it doesn't matter if you can drive yourself. It just, you don't have a hospital. So let's take advantage of that. Let's continue to tell those stories. We all know it was true before this, but people now are believing it and paying attention. So let's talk about it. And the best way is not through statistics. It is through stories. So send your stories our way and tell the stories yourself. The other thing I would say is you can't just support transit. Having a transit system functional means your transit riders have to be able to get there without dying. And I know that that sounds obvious, but we forget it all the time. We have roadways designed to smush people who are outside of their cars. And we're really seeing that right now, that there isn't traffic as a safety precaution. One of the things I am learning is if you don't have traffic, your unsafe roadway design is exposed. And right now, either we redesign our roadways or we need traffic to keep people from being killed. If you don't go to the bus stop, if you have to jeopardize your life to get there. So if you're in favor of transit, you have to be in favor of that roadway being built for people to get to the transit and to get from the transit, especially those that can't scamper. And many of the transit users can't scamper. So that's the second thing. And the third thing I would say is we can no longer, this gets to the funding formula question you asked and why I said that I feel like it was a plant, because we're really pushing back against the 80-20 split. Just a little background for those that are not aware. In 1982, when there was a big effort to raise the gas tax, and it took a while, but when President Reagan got involved in the debate and really started pushing for it, he was having trouble getting urban House members, members that represent urban districts, to support an increase in the gas tax because they were afraid that all of the money would go to rural districts for new highways. And urban highways had been built out to a great extent by then. So the deal that was struck was that a penny of the gas tax increase would go to transit, and the other 4 pennies would go to highways, thus birthed the 80-20 split. And at that moment, apparently it became blessed by God and could never be touched again, not 40 years later. But it was all based in 1982 on a trust fund paid for system. The gas tax is paid for by drivers, therefore the overwhelming majority should go directly to benefit them by the pavement in front of their car. The gas tax hasn't paid for this program wholly since 2008. And yet we continue to operate as if nothing's changed. And now the gas tax has been flattened by the lack of driving. And in the Recovery Act, not 1 penny came from a user fee. And we applied the user fee rules for some unfathomable reason. And now we're heading into a stimulus where we're talking that's going to be all paid with debt. And yet we're talking about an 80-20 split as if it's unfair for transit to get any more than 1/5 or 1/4 of what highways does. That's nuts. We have got to push back. The funding has to go to where the need is. And there's going to be more people who are pinched for cash than ever before. They were already $400 away from bankruptcy in a huge number of households across the country. Many of them are already there because they're well past those $400. We can't say to them the only way for you to go back to work is to start spending a ton of money again. We need to give them access to affordable transit. And that means putting a lot more than 20% of whatever highways is getting into a stimulus package. So those are the three things I'd say. Tell the stories, recognize transit is relying on the roadways being safe, and don't support an 80-20 split, and go tell your representatives that that is very progressive thinking for 1982.
I think you just answered the next question from Lindsay. Is that right? So you did talk about how we can advocate for more federal transit operating funding by dismantling the 80-20 split or finding an alternative to that.
She did also have the question about biking and walking. And I don't know, I actually have not followed whether or not Nashville has made any adjustments to roadways to allow people to be active and spaced out like so many cities across the country.
We did 8
one of the
roads, calling them slow streets.
Excellent. You know, we have really seen cities across the country jump onto this of all sizes. Louisville, Kentucky was one of the early leaders on this. I think they closed down 12 or 15 miles of roadway. They are not looking to speed up the reopening. We've got communities from big to small, you know, everything from New York City to Burlington, Vermont, that have closed down a lot of roadways, some completely, except the local traffic, some quick redesigns. And one of the things that I think is super exciting about that is we need to do, this has allowed the public to experience a change in design and give feedback to their officials that's real. In transportation, we have this odd scenario where we sketch something out on paper. We hand it to average people and say, I'd like you to close your eyes and go into a virtual reality created by my pretty little sketch here. And I want you to walk amongst this reconstructed reality and tell me what works and what doesn't work. How stupid is that? Why don't we make temporary changes and let people go out and experience and say, this is what I like, this is what I don't like, and make more permanent changes based on what people actually experience than asking them to be like living in total recall or something. It's a really strange system. And I think what COVID has forced us to do is more of that tactical urbanism on purpose. And that is a great way to involve your public and do really creative things.
Yeah, we have a local organization here, the Nashville Civic Design Center, and they do participate in tactical urbanism. I think
What's great now is governments themselves are doing it. And I now know of communities that are establishing tactical urbanist departments or staff to do this on a permanent basis. It's really cool. Yeah.
Neat. So, here's an interesting question. What are the prospects for transportation reauthorization bill in 2020?
I give very little chance. This is one of the things that there's some talk about an infrastructure package. And initially the conversation was, we will tack reauthorization on, to which a bunch of people said, oh, so basically what you're going to do in order to create jobs in the near term is spend money over 12 years, which is generally how long it takes for this money to pay out. That doesn't sound like stimulus to me. And then Leader McConnell said, you know, I have questions about whether or not the stimulus stuff works like the way we did it in 2008. And actually, there's a lot of evidence that it didn't create jobs very quickly or move money very quickly. So I think that having it just tacked on to a stimulus package is unlikely. I wouldn't be surprised if some sort of package includes an extension to just keep the current program in place for another year so the new Congress can come back and try to do something in 2021. The House will, however, introduce a bill possibly this week, maybe next week. They're looking to mark up or move the legislation through committee in June. So I think we'll see some action and some statement about where the House is on reauthorization. But I just don't think we're going to see reauthorization happen this year.
Okay. So do you have any specific advice for a low tax region like Nashville? Like we do not have any dedicated funding for transit at all. Just it's basically dependent on the metro budget, which is strained. Let's see, Rochelle says, is our transit agency still the only one you know that is cutting the transit budget, even with the CARES Act?
No, sadly, I wish I could just say, oh, you foolish people in Nashville, but you're not alone. Maryland, the state of Maryland, which runs transit statewide, they've announced that they're using the CARES Act as an excuse to cut money to transit. Basically, transit's got what they need, so we don't have to give them money, which of course just opens up a new hole. So no, you're not alone. I'm sorry to tell you that. I think what you all have got to do is connect that to a harder economic recovery. And so again, just start telling those stories as you reopen. all the people that can't get to work because they can no longer afford to get their car fixed or whatever because they don't have a job. This was me. This was me in school in Baton Rouge, where I did not have enough money to pay my bills. And I looked for a job, but every job required me to have a car to get there. I already couldn't pay my bills, so I couldn't buy a car. But without a car, I couldn't get a job. And without a car, I couldn't, without a job, I couldn't get a car. So that's just a never ending cycle. And the question is, does Nashville think it can be a strong economic power and regain its economic footing when, tens of thousands of people in your region are going to be caught in that scenario? I would argue, I don't see how that's quite possible. And that's the story to tell.
It certainly won't be a quick rebound.
No, it'll
right.
be a painful one. And it will take people who are committed to walk 10 miles, on very dangerous roadways. I mean, that's a true desperate situation. And if that's what you're relying on for people to get to work, that's just not going to be an economically sound approach. So put it in terms of economics. It's what people are going to be most worried about going into the future. Talk about who can't get to work. I would go back to those essential workers, particularly the healthcare workers. So if the mayor thought that it was okay to cut it, tell them who she's stranded, and see if that's a position that ends up being durable.
Right. I can certainly appreciate that response. I have a question here. The Department of Transportation has given transit agencies some new flexibility in how they spend federal funds and hasn't balked as those that have stopped collecting fares as a way to reduce contact between workers and customers. What do you think about free transit service as a long-term strategy for engagement, growth, and recovery?
That is a great question. And I'm really glad to hear the DOT has been supportive of the flexibility. A really engaged and Department of Transportation that wants to be a partner is going to take that attitude. They know they need flexibility themselves. They're going to engage with you. It's great that you have that kind of partnership. There's a lot of reasons fare free might be the way to go in the short term. And there are a bunch of agencies like in Kansas City that were already trying it before the shutdown. This is my positive spin on it. This is a time where experimentation is going to be the easiest to do. We should try everything. We should throw spaghetti at the wall and see what we learn. Look, we're doing it in education. I was just on the phone with my third graders principal talking about what we did wrong this semester, what we need to do next semester, because they're not looking at bringing all the kids back into the school at one time in the fall. So what does that mean? But it means all the way we used to handle things is not the default position. Let's take advantage of that and let's just go try things out. And free fare is one of them. Free fare to me is a great option. It's not the only option that can work. A bunch of agencies are starting to move their fare collection to the back of the bus so that you don't have to have an interaction with the driver in order to pay. They're investigating paying by phone. They're investigating paying in ways that give you tokens so that the bus just automatically recognizes you when you walk through the doors. You're either paid for it or not. There's all kinds of things that people are looking at. And, it really just depends on the region. I have a whole spiel on how to pay for transit. And the answer is there are 100 ways to pay for transit. They're all hard. The goal is paying for things is hard, period. The question is, have you made a credible case for it? And have you found the way that the community is willing to do it? And have you found a way that allows you to grow a system? And in some areas who are really committed to transit and want to put real money towards it, like in Kansas City, where they're putting property taxes towards it because businesses see the benefit to them and they want to pay in because they see it as bringing them customers, they can do fare free. Other areas that are always looking for an excuse to cut transit, fare free will be your newest excuse to cut transit because now it costs so much money. So you just got to think about your own local circumstances and the case you're making and who's committed to it and who isn't committed to it that you can bring on board.
Yes, thank you. We have a question here. How do transit operators deal with consumers or riders who don't want to wear masks and passengers having conflicts between them? What do you see as the best policy?
God, boy, another just Amazing question. I don't have great answers on this. We are seeing a real breakdown in the coalition that supports transit over this issue. The operators want everyone to have masks for very understandable reasons. I was on the phone recently with the CDC, who is saying that actually PPE is the lowest level of protection. There are all kinds of other things you should be doing first, especially for operators. If you're down to PPE, you're kind of blowing it, is what they said. You need to think about truly encasing the driver, moving people away from the driver. Once you're down with PPE being the only form of protection, you haven't really taken the proper steps. But when it comes to riders, this is going to be a very big issue. And we're going to have to talk to our riders. And more importantly, we're going to have to talk to those who aren't riding. One of the biggest mistakes that transit operators do is they pull their existing riders and not the people who are choosing not to ride for whatever reason. A smarter move is to ask people who aren't on transit why they're not on transit and make adjustments to bring them on. In all reality, it is likely to benefit those who are on too. Not saying not to talk to the people who are on, but recognize that you're missing a lot if you're not talking to those who opted out. So I think that there's a lot that we could do in talking to people who have dealt with the challenges that the general public is dealing with now, those who have had those challenges all along. While the general public is now all of a sudden afraid of communicable diseases, there were actually tons of communicable diseases that killed tens of thousands of Americans just before this. Well, some people talk about the flu as if, well, I'm willing for 60,000 people a year to die, so why not 120,000 people to die now? That's not the attitude I'm bringing to this. What I am saying is I wish people had cared about those dying from flu before and taken action that would have helped protect us from COVID. So I am a recipient of a kidney transplant. And those of us that have gone through transplant have to take drugs that suppress our immune systems. And we have had to deal with these issues that everybody else is new to all the time. Go talk to them. What got them back on transit? What made them comfortable? What are the changes that needed to be made to give them a sense of control and protection of their own health? And that will tell you a lot about what will bring other people on as well, and what the transit operators, the systems can do. Now, in terms of disputes between passengers, this is a massive challenge. Where we have seen enforcement of masks, we have seen it doled out very differently for white riders than people of color. We have seen people of color dealt with quite violently, not just by other riders, but by the police. We're going to have to bring that consideration into it. We've also seen people of color wearing masks dealt with very poorly. So we have to think about that. We are going to have to think about what about someone just doesn't have access to a mask? Are we going to offer them masks? What about there are certain disabled people who really can't wear a mask, some with some breathing problems and with some manipulation problems. So we have a lot to figure out there. And I don't think anyone has an answer, but this is one of those places where transit agencies that are trying stuff, we need to hear what they're trying, what's working and what's not working. And we're going to learn this together. We also could turn to some agencies abroad who have opened up and been operating for a while with much closer to their regular ridership and see what they've done and try to learn from them. I know that we resist learning from other countries, but reinventing the wheel takes a long time. So I would suggest that we pull from experiences abroad.
Great. I've really enjoyed this conversation. We're down to the last 7 or 8 minutes. I do want to get pick your brain a little bit. Beyond COVID, what other challenges in transportation transit have you come across, and or do you think we'll be facing in the next 2, 5, or 10 years?
Honestly, before COVID, I thought transit was moving along quite well. We were seeing huge support for new transit funding across the country. I know your region has struggled with that, but that's one place where you do kind of stand out. Bad news.
We're number one.
Most regions have been really getting very excited about putting more money into transit. We have a whole coalition called Chambers for Transit, because it's so tied to economic productivity to have frequent, strong transit. And I think some areas like Nashville that were doing well economically kind of felt like that would never end. But other regions have found that they have more long-lasting economic productivity in areas that they have frequent transit, and so they're just a little bit further along in terms of that curve. And I hope Nashville kind of catches up. But maybe talking with some of those other folks in the local business communities and what they've learned could help. They've also been quite creative. I think they're getting even more creative now. But they were doing really interesting bus redesigns. One of the things that I've always found interesting between those who have bus systems or are supporting a bus expansion versus a train expansion is everyone talks about the great flexibility of investing in buses. But as soon as you put a bus stop in, you are gonna, endure the wrath of God to remove that bus stop. It's got more permanency than almost anything I've ever seen in my existence. So, for all the flexibility that we're sold on, it doesn't really tend to have it. It's a big deal to do a bus redesign. It's a big deal to even lift here in DC. There's a route I ride that has 4 stops, block. There's not even a 2-block gap between the stops. You can imagine how messed up that system gets along those 4 blocks. So we've been seeing systems from Houston to Des Moines to Columbus redesign their systems, look at where their populations have shifted, really creatively reacted to where the workforce needs to go. We seem to think everyone commutes at the same time. We're learning certain lines require more service outside of the traditional rush hour. Healthcare institutions are amongst the top. And using really interesting technology to discover where people are moving, not just those on transit, but where people are moving. We do an analysis we call an accessibility analysis, meaning access to jobs and services, but particularly to jobs, where we can see where everyone is going, what the main points of connections are between where the houses are and where the jobs are. And just like, whether or not people are getting on transit, if the transit is strong between those typical connections, that's where you're going to get the ridership. So, using those sorts of technologies now that we have GIS, GIS is better deployed in personal use on our smartphones than it is by transportation agencies, and seeing them adopt it and really put it to good use has been exciting. Another thing is watching them collaborate with partner agencies in terms of making transfers between systems more seamless, making connections to micro transit, to ride sharing systems, to like bike and scooter systems and things like that. Those were really promising, and I'm hoping that COVID just encourages them to do more of it, because I think it's looking more at the way people move rather than what is your fiefdom of transportation service. And that's a more customer-based system that's more likely to be helpful and successful.
It's like keeping in the forefront of your mind that you're providing a service.
Yes, you're trying to connect people from point A to point B. And even in the highway system, we get so caught up in the fact that there's a bottleneck here that we put all of our attention to the bottleneck that we don't even know what the origins and destinations of the people traveling through that are. If we started from that origin destination data, we might find that a smarter move is to route people a different way. Or that while, yes, there is a slowdown there, it's not a significant enough amount of their time to put money to. There's all kinds of things we could know, but since we don't know where people start and where they're going and whether they ever get there, because we don't measure that in transportation, we actually are quite disconnected from the user's experience. I think transit agencies are doing a better job of getting past that. I'd love to see the highway agencies catch up.
Yeah. Any last words of wisdom that you'd like to leave us with before you go?
Well, I have to brag on my organization. I beg people to come and look at what we're producing. We produced a lot of really great reports. The Repair Priorities looks at the fact that everyone says repairing their system is their number one priority, and it looks at their spending to see if they are telling you the truth, because the spending will not lie. And spoiler alert, they're not. Two is We have a congestion report that asks the question of whether or not congestions are caused by not keeping up with capacity expansion as your population growth goes. The answer is it's not. We've actually seen congestion increase in areas that are outpacing their highway growth, outpacing their population growth with highway expansions. We've actually seen areas lose population, build more highways, have more congestion, and not a little bit more congestion, a whole lot more congestion. None of the top 100 largest communities in the country have seen a decrease in congestion no matter what. Highly recommend you go check that out. Check out our Recovery Act analysis and the cases we've made for transit. Follow our blog. We will be putting out great information about what's going on, what's your chance to jump into the conversation and have the greatest impact. And that's a good place to interact with us and share your stories, because we want, especially when you've had successes, we want to tell your successes and brag on you. And where you're running into trouble, I guarantee you're not the only one. And I'd love to find ways to link you up with other people that are fighting the same fight and see if you all can't lean on each other to come up with a solution.
Oh, that'd be excellent. Yes. To united we fight we fall, united we win.
Absolutely. Absolutely.
Better way to put it. Well, thank you so much for joining us, Beth. You're doing incredibly important work. I'm so thrilled that you could join us and bring this conversation to our community. I think it's really important. We've been beating the drum of transit is essential since the beginning of COVID. When we started flattening the curve here, and you really add something to the conversation that wasn't here before. And I thank you so much for that. For those who are on the call and attending, thank you so much. If you liked what you heard here today, I encourage you to register for our Transit Citizen Leadership Academy. It's free and it starts June 15th. You can find out more information at thetransitoalliance.org/TCLA-registration. And with that, thanks.
Thanks again.
Mm-hmm.